We'll be looking at a public health concern. Nigeria became the first African country to receive Mpox vaccine amid an outbreak with 39 confirmed cases. WHO is supporting efforts to enhance surveillance, lab capacity, and cross-border monitoring. Lagos State launches a campaign against the new Clade 1B variant despite having no active cases. We have joining us via Zoom Dr. Bala Muhammed. He is a public health scientist and a private veterinary practitioner. Good morning, doctor.
Good morning, and thank you for having me.
Thank you for joining us. Before we start with the number of, or rather the doses of vaccines that we have received, can you help educate Nigeria on what exactly we are dealing with when it comes to Mpox?
Mpox, as we may have heard, and then from also the name monkeypox, is a disease that for every student of veterinary medicine is very much familiar with. It is one of the zoonotic diseases. When I say zoonotic diseases, those diseases that will jump their animal species to human species, and it was first identified in animals, but you know why monkey pox? It was first discovered around 1958 when colonies of research monkeys came down infected with the virus. And ever since that time, it became a thing of concern. And until around 1970, when we were dealing with smallpox, and Mpox was also still there, predominantly found in the giant rat, also in the monkeys, almost all the group of monkeys, but also in squirrels. Squirrels here, we must understand the two types of squirrels that we have, the sun squirrel and the rope squirrel are predominantly reservoirs of this disease. But because it was first discovered in the monkey, it is labeled monkeypox. Now, it is a grave zoonotic disease of concern because it has caused a lot of deformities, it has caused a lot of disease, and in recent time, we have also seen mortalities, which is not what we have been used to seeing. And it also led to its categorization as highly contagious infectious disease, otherwise classified into clade 1 and clade 2. Clade 2 being the one that is less infectious and is mostly found in the West African sub-region, from Nigeria, Niger, down to Cameroon, part of Nigeria, Cameroon, down. And the one that is most dangerous is the one found in Central Central Africa, which is labeled, characterized as clade 1. That in the recent time has led to fatalities, and why it is also gaining international attention now is simply because it has the mortality rate could be up to 20% in those infected, and it has been found in about 5 continents. And that tells us that a lot of things may have been happening to the virus in terms of mutation, in terms of reassortment, to making sure that they adapt the new human host.
All right, Doctor. Lately in Nigeria, we've been dealing with quite a number. We have the issues of diphtheria taking down people just across the country. We are barely out of the woods in terms of cholera now with the increasing flood situation across the country. How do we identify the symptoms of this mpox, and what should we do really, to safeguard against contracting this disease?
So this is a viral disease, and it is highly infectious. And I mean, you could see blisters that could, if not managed well, could be more permanent, or it could take like up to a year producing this kind of blisters, and therefore makes it highly infectious. Now, it is not only it is transmitted again through bodily fluids, from semen to saliva to even physical body contact like hugging and contamination with those sores that you have found. And therefore, it is very important that we have to look at its mode of transmission before we talk about prevention. So human to human transmission is pretty very difficult. I mean, it's pretty easy with clade 1, that is the one found in Central Africa. But it could also happen with the clade 2 version that Nigeria may, for now, be infected with. And therefore, the mode of transmission of these two different characters are the same. And we have to look at first, how did we get it from the human, like from the animal species? And it's simple, where you have walkers who walk in the zoo, hunters who are always in contact with this wildlife. Remember the categories of the reservoirs, the Gambian rat, or the one we know as giant rat, and then the squirrels. They are all over, particularly around the coastal areas and then the forest. You see them a lot. Now, you hardly will have a hunter go in for his expedition and then not coming back with one of these. And even mere processing, remember that these animals may not fall sick, but the fluid in their body, the blood, the secretions, their skin, their saliva could be loaded with this virus. And in the process of even catching, touching, processing for those ones captured for eating, cooking, and even consumption, we could be we could get infected with the virus. Then when you also look at the other side of it, human to human infection, we need to be very, very careful. And here I would like to talk to my colleagues who are at the forefront in terms of incident management. You don't see it and think it is smallpox. Monkeypox and smallpox are almost the same. And the only difference is in its severity in terms of the like fatality, and then the fever, the pains, and the way the blisters occur. But they are virtually all the same. So if we have been alerted by the World Health Organization that it is a pandemic, then we need to do all that Lagos State government is doing now by activating our emergency operation centers. This center will ensure that those who are likely going to come in contact with these patients identify it and do not misdiagnose it. And by so doing, we should also strengthen the biosafety and biosecurity around our hospitals where some of these patients will be coming through. But importantly, the moment you see anything that looks like the smallpox that we know, please take it serious. It's not, nobody should be stigmatized. Report to the appropriate health center, and I'm very sure you are going to get help almost immediately.
All right, thank you, doctor, for that. Now, let's quickly talk about treatment options. Like you said, it's something that, you know, Lagos State has opened the centers, you know, to tackle it first on, and the fact that it's been declared important by WHO. Now, let's talk about vaccines. Nigeria has received vaccines, and let's also look at treatment options. What are the treatment options available? And when it comes to the vaccines, who are those that should be considered first in line to receive the vaccines, being that, you know, it's quite few?
So, Mpox hasn't gotten treatment. It can only be managed, and you do so taking care of those signs, the pain, the sharp pain, the high fever that comes with it, the emergence of the blisters, and some other things. You know, with Mpox, there is this uniqueness in terms of a sharp backache. The back, you know, the backache a lot. And then the fever is also not like the normal temperature that we know. Those things can be managed while you wait. And between 7 and 2 weeks, if you manage all of these signs, the fever and some of these symptoms, you are likely going to get out of it. But for the vaccine, it is important. I did mention earlier that smallpox and Mpox are from the same family. They are, in fact, they are cousins. And in the 80s, Nigeria aggressively, you know, worked very hard with international development agencies between 1970 and 1985-90, where we were able to eradicate smallpox. And what did we do? Vaccination. And if you ask me those who should get the vaccine, I will first categorize them. I mean, if I am the NCDC DG, I will first of all want to look at those at the front line in terms of incidence management, and followed by children, and those around the coastal area, or if you also ask me, those who walk around the airport, the seaport, and the border stations into receiving guests into the country should get it. Then we can now go down to check for their occupations, hunters, and those who work in the zoos, those who are also likely, for some of us as vets that go to the zoo and we attend to some of these animals, we should also be considered as the front line workers when it has to do with management and control of Mpox. I like to highlight here, just like we used to know smallpox, it is Mpox is very, very severe when found in children. And therefore, I think government will find a way that the same kind of ways we've been getting the children through these vaccines, that it is reconsidered in the vaccination program.
Thank you very much, Dr. Bala Muhammed, for providing us with this very enlightening information around Mpox and what we can do, you know, to contain what we are dealing with, both as a country and as individual.
Thank you.
Thank you.
Hello?
Yes, please.
Can you repeat that?
I'm just thanking you for finding time to join us and provide us with that enlightening session on Mpox.
My great pleasure talking to all of you, and then thank you for doing this for Nigerians. It's important that we stay ahead, and the major vaccine and vaccination is that we must take our hygiene very seriously, and I quite appreciate this awareness that your station is creating. Thank you for having me.
Thank you very much, Dr. Ando. Have a great day. Very, very interesting enlightenment session there with Dr. Bala, who is a public health scientist and a private veterinary practitioner based in Lagos. We'll take a quick breather. When we return, it will be time for the stories that made it to the front page of select newspapers this morning.